thank you for having me today. And I would like to talk to you a little bit, just a few minutes, about what we're doing here at Candem Clark. Candem Clark is a member of the West Virginia University Health System. We're one of 19 hospitals in West Virginia, Ohio, Pennsylvania, and Maryland. We also have several clinics. We have 302 licensed beds. We are right on the border of the Ohio River. And we are the first hospital in West Virginia to adopt the RQI program. It's only by 2 weeks, but we're really proud of that. And we've been a participant in Get With the Guidelines resuscitation since 2010. And prior to that, we were with NR CPR since 2002. This year, we received the American College of Cardiology for Excellence in Cardiac Care, including our resuscitation. And in 2020, we got the Silver Award with Get With the Guidelines, and I believe we're getting the Gold Award this year, so we are pleased with that. So we began, as I mentioned, in 2010. And when we talked about why would we want to do this, well, we know that Get With the Guidelines, resuscitation, and the vision of our hospital and our system is to provide the best care we can for our patients. And that includes best practices, evidence-based learning, and we know that these two go together. And Get With the Guidelines makes it easier for our teams to put that proven knowledge and guidelines to work. We can compare ourselves to facilities of like size, not only locally, but nationally. So we were very excited about doing this. When we first started back in 2017, you can see on this slide here, we have had a positive increase in the number of patients who survive the initial code. We believe that every clinician everywhere in our facility needs to be able to deliver that high quality CPR. We also knew that there are gaps in memory or training. If you only have a class every 2 years and you don't even do CPR within those 2 years, your ability to perform greatly decreases. So we wanted every person, every employee who touches a patient to be able to deliver high quality CPR, because we know it's high quality CPR and early defibrillation that saves lives. Today, we have about 1,000 BLS seats in RQI. We have 350 in ACLS. And we just added PALS this quarter, and we have 50. And we're already at that limit. We're going to have to add some more. So RQI lets us look at employees, looks at departments to let us see where do we have gaps in performance? What can we do different? This was seamless with the new guidelines that came out in October and January. Our employees had all of the new guidelines. This was just a natural fit with us. So as you see here, here's our compression and ventilation scores starting in 2017 to 2019. And you can see that the high scores and the low scores are coming closer together, which is what we want to see. You notice in 2018, our ventilation scores took a dip. We added several new departments then, and sometimes ventilation is more difficult for people than the actual chest compressions. So we've had a 127% increase in our enrollment since 2017. Now this data is just from last year. So this is our average. So in the first quarter of 2020, it took the average person 2.37 times to get the chest compressions correct. That includes depth, rate, recoil. By fourth quarter, they had made an improvement, as well as if you look at the chest compression average score went up from 78 to 85.6. Our ventilation attempts also went down. The more they completed this quarterly activity, they got better at it. and look at the difference in the average score. So we were pleased with that as well, because that translates then to better compressions and better ventilations for our patient. This is how quality improves outcomes here at Candem Clark. With the guidelines resuscitation, we have a clear understanding of the AHA guidelines. Every code is reviewed. If there are issues, it goes to the resuscitation committee and the RQI administrator. We are committed to documentation and improvement, and like every other facility in the United States, we often struggle with documentation. So every code is reviewed as soon as possible. So we look to see where there are documentation issues and can they be corrected. With RQI, we get quarterly cognitive and skills validation of our staff. And this can, as I showed you, the analytics for compressions and ventilations. Not only can we look at this house-wide, we can do it by department, we can do it by individual. For example, if we have, fortunately for us, few pediatric codes, but if we notice perhaps the EDs having some issues with pediatric ventilation, we can work with them, provide them extra education, extra in-services on that. Throughout the pandemic, we were able to continue CPR skills, the mastery and the compliance with that. We didn't need to cancel classes. They could continue once a quarter, completing the cognitive part on our LMS system, going to the cart, completing their skills. So even though American Heart, and we were thankful that they did give extensions, we were able to continue that. However, with social distancing, it became an issue for us with new hire orientation and how would we do CPR. We do not have facilities large enough that we could do 20 people 6 feet apart with all the equipment that is needed. So we decided we would try implementing those people immediately into RQI. With RQI, you have two choices. You can put them in an entry level. Maybe it's somebody who comes with a current card or their card expired just last year. Or there's a prep course, someone who hasn't had CPR in 5 years or never had it. And this has saved time not only for us as an institution as far as instructor time, but it's also saved time for the new hire, because instead of setting in a 3.5 to 4 hour class, they work through at their own pace. If it's an experienced person, they often get through the cognitive part very quickly, go do their skills, then they can spend the rest of that time that they would have been sitting in a class on their unit being oriented. So that has saved us time and money for the new hires. The outcomes we have of this continuous cycle of documentation, measuring it. What are we improving? Continuing that. As our earlier speakers mentioned, we did mock codes with the COVID guidelines that came out, and getting the PPE on was the most time consuming. So we had several COVID units and we practiced with our staff on getting that PPE in, having somebody at the door, limiting the number of people that could go in. We also work with our residents once a month to ensure that they maintain their competencies and their skills related to AHA guidelines. We have a team commitment to improving and mastery of basic CPR skills, and which leads to more lives saved, which is what we want. How this all works is we have a Get With the Guidelines abstractor. She does all the code documentation as far as into the registry. Every code, as I mentioned, is reviewed. We look at people's CPR skills, and then we have a resuscitation committee that looks at any issues that we have. So these three all pulled together helps improve the quality of care we provide to our patients. So we believe here at Candem Clark that Get With the Guidelines resuscitation, as well as RQI, that these two fit together. They help us with our quality, They help us provide our patients with the best care possible, get with the guidelines, follows the protocols, effective and timely resuscitation. And RQI, then we have that verified competency, that quarterly learning that our employees who deal with these situations, they do know high quality CPR, and we all know that is what saves lives. Thank you.